My name is Javier Cardenas. I am the director of the Barrow Concussion and Brain Injury Center at Barrow Neurological Institute.
I started doing some research, and in looking at the research, there was a fairly high correlation of traumatic brain injury and homelessness, and then looking at other vulnerable populations in terms of traumatic brain injury, I started looking at the correlation between domestic violence and traumatic brain injury right along with homelessness. And once I saw that there was a fairly significant correlation between the two, I started talking about it with everybody that I knew until I met Dr. Javier Cardenas, who was the first physician that really, truly listened to what I had to say. And during that conversation, he made it very clear very quickly that he was interested in helping this population. And so together, we were able to develop this program to address traumatic brain injury, specifically in the vulnerable population of domestic violence survivors living in domestic violence shelters.
Our work mainly is to help people who are victims of domestic violence or other abuse recover from their injuries. And a lot of this, in a day-to-day basis, is not only treating the patients, but also educating the patients as far as what a traumatic brain injury is, what symptoms they're having, and if those are related to their injuries, because a lot of times they're just really sometimes relieved to understand that the reason they have trouble parenting their children or holding a job or filling out applications is not because they're crazy or dumb, as some people tell us, but it's because they've suffered injuries, and there's actually a pathological reason behind this.
I see the work that we're doing in terms of marrying the brain injury community with the domestic violence community having impact not only on the services within our own community, but now other communities are starting to talk about it and starting to think about the kinds of case management and the kinds of resources and the kinds of services that need to be available to women that are experiencing traumatic brain injury as a result of domestic violence. And so it's just been an incredible journey over the past, I guess, almost 5 years that we've been doing this program, and so grateful to the doctors in our team that feel as passionate about this work as I do.
Well, we're very fortunate at the Barrow Concussion and Brain Injury Center to have such a program as the domestic violence program. What has inspired me most about this particular program is actually the patients. The victims of domestic violence, when they're telling their story, is at the same time humbling, devastating, and inspiring.
I'm so grateful that I get to do this work. It's really, God, it's amazing.